Have you ever wondered why one of your legs suddenly feels heavier, colder, or tighter than the other? Why some mornings you stand up and it feels like someone tied a weight to your calf? And more importantly, could these small changes be warning you about something far more dangerous than aging? Here's the truth most people never hear. The earliest signs of a blood clot are often silent. No sharp pain, no dramatic swelling, just tiny changes in your legs that are easy to ignore, until the situation becomes an emergency. A slight pulling sensation behind your knee, a patch of skin that looks a little redder or darker than usual, a sudden chill in one leg while the other feels completely normal, a tightness that feels like a stretched rubber band. Most people call it sleeping wrong, walking too much, or getting older. But in many cases, these are SOS messages from your body warning you that a clot may be forming quietly inside your veins. And here's the frightening part. Up to 80% of early blood clots cause no real pain at all. No loud warning, no obvious signal, just subtle changes that millions of people overlook every single day. So how do you know when your legs are simply tired and when your body is begging you to pay attention? In the next few minutes, I'm going to show you the 7 leg symptoms that cardiologists and vascular doctors recognize instantly, but the average person misses completely. And trust me, symptom number 7 is the one most people never notice until hours before the clot travels toward the lungs or heart. If you've ever felt unexplained heaviness, swelling, coldness, or tingling in one leg, this is not just another health video. This may be the most important warning your body has been trying to send you. Stay with me until the end. Your legs, your lungs, and your heart may depend on it. Sign number 1. Unusual heaviness or fatigue in one leg. One of the earliest and most overlooked warnings of a developing blood clot is when one leg suddenly feels heavier than the other. It's that strange feeling when you stand up and your left leg sinks into the floor while your right leg feels perfectly normal. You haven't exercised, you didn't twist anything, yet that deep, dragging heaviness is there, almost like someone slipped a sandbag into your calf overnight. Many people describe it as a dull pressure or a tightness that stays with them throughout the day. Even simple things like walking to the kitchen or getting out of the car suddenly feel harder on that one side. You might notice your calf feels tight, swollen, or full, even though it looks almost the same as usual. So why does this happen? When a blood clot begins forming inside a vein, it disrupts the natural flow of blood returning to the heart. Think of your veins like long tubes running uphill. If something blocks the tube, even partially, blood starts pooling behind the blockage. That trapped blood creates a heavy, weighted feeling, very similar to water backing up in a clogged pipe. This kind of heaviness should never be brushed aside, especially when it lasts longer than 24 hours and doesn't get better with rest. If you wake up the next day and the sensation is still there, or worse, it feels tighter, heavier or different than your normal aches, your body may be alerting you to something more serious than simple fatigue. Here's the problem. Most people confuse this symptom with age-related stiffness, arthritis flare-ups, dehydration, low magnesium, or just having one of those days. And while those things can cause leg discomfort, they rarely affect just one leg so suddenly and so noticeably. If one leg feels off, heavier, tighter, or harder to move, don't ignore it. Your body might be whispering the first warning of a clot before it becomes something far more dangerous. Sign number 2. One-sided swelling. From mild to noticeable swelling in just one leg is one of the clearest signs your body may be struggling with a developing blood clot. Yet, it's also one of the easiest symptoms to dismiss. Many people first notice it in small, subtle ways. For example, when putting on socks in the morning, one side leaves a deeper indentation than the other. Or the top of your foot looks a little puffier, even though there's no pain, no injury, and no obvious reason for it. What makes this symptom so tricky is that it often feels harmless. The swelling might be mild at first, just a soft fullness around the ankle or the top of the foot. You may look down and think, that's odd, but then go on with your day because it doesn't hurt. But here's what's actually happening beneath the surface. When a clot forms in a deep vein, it blocks or slows the return of blood back to the heart. Imagine closing off part of a garden hose. Water begins to collect behind the blockage. Your veins work the same way. As blood backs up, pressure increases and fluid leaks out into the surrounding tissues, causing swelling. This is why the swelling usually appears on one side only. The affected leg has nowhere for that trapped blood to go. So when should you be concerned? If the swelling becomes warm to the touch, turns reddish, or starts spreading quickly, that is a red flag. Swelling that increases noticeably over just a few hours suggests the clot may be growing, and this requires immediate medical attention. Even a mild puffiness that doesn't match the other leg should never be ignored if it appears suddenly and without a clear reason. And here's where many people lose precious time. They assume the swelling is from eating salty food, standing too long, or sitting with their legs down. While these can cause temporary fluid retention, they rarely affect just one leg so sharply or so suddenly. If one leg looks fuller, tighter, or heavier than the other, even if it doesn't hurt, your body may be sending you a quiet warning. Swelling is one of the ways your circulation says something's blocking the flow. Paying attention to this early sign can prevent a clot from turning into a life-threatening emergency. Sign number 3, skin discoloration, blue, red, or unusually pale patches. One of the most alarming, yet commonly overlooked warning signs of a blood clot is when the skin on one leg changes color in a way that doesn't make sense. You might notice a patch that looks darker, redder, or even slightly blue compared to the other leg. Or the skin may appear unusually pale, almost like the blood has been drained from that spot. At first, you might think it's just irritation from clothing, dry skin, or poor circulation that comes with age. But when the color change appears on only one leg, especially in a specific area, your body may be trying to tell you something much more serious. Why does this happen? Your skin is like a mirror reflecting what's happening inside your blood vessels. When a clot interrupts the normal flow of blood, the tissues in that area stop receiving the oxygen they need. Without oxygen, the skin responds visibly. A bluish or purplish tone may appear when blood is trapped and not moving properly. A red, warm patch may show up when the surrounding veins become inflamed as they struggle to push blood around the blockage. An unusually pale or washed-out area can indicate that blood supply is being choked off. These changes don't happen randomly. They are direct signs of a disrupted blood flow. So when is this an emergency? If the discoloration spreads quickly, becomes deep purple, or the skin feels cold to the touch, doctors consider this a medical emergency. It may mean the clot is large, the blood flow is severely restricted, or tissues are starting to suffer damage. Cold, blue skin is a sign that your leg isn't getting the oxygen it needs, and time becomes critical. Unfortunately, this is also the symptom most people dismiss. They say things like, "My circulation isn't what it used to be," or "That's just aging." But aging alone does not cause sudden, one-sided, dramatic color changes. A clot does. If you ever notice a patch of skin on one leg that looks completely different from the other, and it shows up suddenly, don't brush it off. Skin discoloration is your body's visual alarm system, asking you to pay attention before a hidden clot becomes a life-threatening emergency. Sign 4. Calf pain while walking, but relief when you rest. This is one of the most confusing and most misleading symptoms of a developing blood clot. Many people suddenly notice a strange tightness in their calf when they walk. It feels like a rubber band being stretched inside the muscle. You take a few more steps, hoping it will loosen up, but instead the tightness grows sharper, deeper, and more uncomfortable. The moment you stop to rest, the feeling eases, almost like nothing happened. At first glance, it seems harmless. After all, leg cramps happen to everyone. But when this pattern repeats, pain with movement, relief with rest, pain again when you move, it could be a sign that blood flow in that leg is being restricted. Here's what's going on underneath. When you walk, your muscles need more oxygen. Normally, your veins and arteries work together to deliver fresh, oxygen-rich blood to your legs. But if a blood clot is blocking part of a vein, that increased demand can't be met. The muscles start starving for oxygen, and you feel it as a deep, pulling tightness or pressure in the calf. This isn't the same as a regular muscle cramp. A cramp is sudden, sharp, and usually goes away with stretching. A clot-related pain builds gradually with activity and fades when you stop moving, only to return when you start again. So when should you be concerned? If this type of calf discomfort is new for you, especially if you haven't increased your activity level or changed your routine, it deserves attention. Blood clot-related pain doesn't typically come and go over many months like arthritis or chronic tightness. It often begins suddenly, within days or even hours, and feels different from your usual aches. And here's where many people make a dangerous mistake. They assume it's dehydration, a pulled muscle, or a sign they need more stretching. This is especially common among older adults who walk regularly or try to stay active. The truth is, if resting immediately relieves the pain, but walking brings it right back, you should not dismiss it. Your body might be signaling that part of your leg isn't getting the blood it needs. If the tightness keeps returning, or if it feels deeper and more persistent than a normal cramp, don't wait. Listening to this early symptom can prevent a clot from traveling deeper into the leg, or worse, breaking loose and heading toward the lungs. Sign number 5. One leg feeling cold or numb, not matching the other. This warning sign is subtle, quiet, and incredibly easy to overlook, yet it can be one of the earliest clues that something is blocking blood flow deep inside the leg. Many people first notice it when they touch their legs in the morning or while sitting in a chair. One leg feels noticeably colder than the other, even though the room temperature is perfectly normal. It's not the kind of cold you feel from a chilly floor or a drafty window. It's deeper, a coolness that seems to come from inside the leg itself. Sometimes it's paired with a mild tingling or a gentle numbness, like the leg is falling asleep without a clear reason. And what makes this symptom so deceptive is that it usually doesn't hurt at all. So why does one leg suddenly feel much colder? Temperature is one of the simplest ways your body communicates circulation problems. When blood flows normally, it brings warmth to the skin and tissues. But if a blood clot slows or partially blocks the flow in one leg, that side no longer receives the same warmth and oxygen. As a result, the leg begins to feel cooler, and nerves in the area may misfire, leading to numbness or tingling. In other words, the coldness isn't coming from the outside, it's coming from the lack of blood inside. When should you worry? If the cold sensation grows deeper, almost like the chill is beneath the skin, or if the leg looks pale compared to the other side, that's a concerning combination. Add slight numbness or a feeling of less control, and your body may be signaling decreased blood supply. These symptoms should never be ignored, especially if they appear suddenly. Unfortunately, many people brush this off with a simple explanation. It's just poor circulation. I'm getting older. While general circulation issues can cause cold feet, they usually affect both legs, not just one. Sudden, one-sided coldness is far more suspicious and often linked to blood flow obstruction, including clots. Think of this sign as a gentle tap on the shoulder from your body. It's subtle. It's quiet, but it matters. If one leg is consistently colder, more numb, or just doesn't feel right, pay attention. Your circulation may be trying to warn you before a more serious event occurs. Sign number 6. Unusual vein changes, bulging, hardening, or tender to the touch. Another warning sign that often slips under the radar is when the veins in one leg start to look different. Maybe you notice a vein that's suddenly more raised, more twisted, or feels firmer than usual. Or when you gently press the area, there's a surprising tenderness, not sharp pain, but a deep, uncomfortable sensitivity that wasn't there before. For many people, this change shows up gradually. One day the veins look normal, and the next they appear more prominent or almost rope-like beneath the skin. You might even feel a slight warmth or notice that the vein is more visible when you're standing. So why does this happen? When a blood clot begins forming in a vein, the surrounding area often reacts with mild inflammation. The vein walls can become irritated and swollen, making them appear more pronounced on the surface. Imagine traffic building up behind a lane closure. Everything slows, backs up, and puts pressure on the surrounding area. Your veins behave the same way. The inflammation also explains the tenderness. Even a light touch or lifting your leg in a certain position can make the discomfort worse. This tenderness is a key difference between a harmless, visible vein and one reacting to a clot. When should you take this seriously? If pressing lightly along the vein produces discomfort, or if lifting the leg increases the tenderness, it's time to pay attention. Pain that worsens with gentle pressure is a classic sign doctors watch for when evaluating possible clots. It suggests that the vein itself is inflamed and struggling with blocked flow. Unfortunately, many people dismiss this symptom right away. They assume it's just normal varicose veins, something that comes with age.
And yes, varicose veins are common, but they typically develop slowly over years, not suddenly over a few days. They also tend to affect both legs more evenly. A clot, on the other hand,
Often causes sudden, one-sided changes that feel different than your usual vein patterns. If you notice a vein that looks or feels unusual, harder, more twisted, more tender, or warmer, don't ignore it. Your veins may be telling you that something deeper is happening and that the flow of blood is being disrupted. Catching this early can make all the difference. Sign number 7. Shortness of breath or chest tightness paired with leg pain, a sign the clot may have traveled. This is the most serious and most urgent warning sign of all. If you suddenly find yourself struggling to breathe, feeling lightheaded, or noticing your heart racing, especially if you've had any of the leg symptoms we've talked about, your body may be signaling that a blood clot has already moved from your leg toward your lungs. Many people describe the feeling as if they can't get a full breath, or like someone is lightly pressing on their chest. Others feel a sudden wave of weakness, dizziness, or an unexplained sense of panic as their body realizes something is wrong before their mind fully catches up. What makes this so dangerous is that it can happen quickly, sometimes within hours of the first leg symptoms. Why does this happen? When a clot breaks loose from a vein in the leg, it travels upward through the bloodstream. If it reaches the lungs, it can block the arteries that carry oxygen into the bloodstream. This is called a pulmonary embolism, and it is a life-threatening emergency. Without enough oxygen, your heart has to work harder to pump blood, and your body sends out alarm signals: shortness of breath, chest tightness, rapid heartbeat, and a sense that something is terribly wrong. So, when should you call 911? The moment shortness of breath appears, together with chest pain, dizziness, sweating, or a rapid heartbeat, you should seek emergency help immediately. This combination of symptoms means oxygen levels may be dropping fast, and every minute counts. Even if the feeling comes and goes, or you try to convince yourself it's nothing, do not wait. Pulmonary embolisms can worsen suddenly, and early treatment can save your life. Here's the heartbreaking truth. Many people mistake these symptoms for anxiety, stress, or fatigue, especially older adults who are used to pushing through discomfort. They tell themselves to rest and see if it goes away. Unfortunately, this delay is exactly what raises the risk of severe complications or even fatality. If you ever feel sudden difficulty breathing paired with any recent leg swelling, heaviness, discoloration, or tenderness, take it seriously. Your body isn't trying to scare you, it's trying to protect you. Listening to this final, urgent signal could be the difference between life and death. When your body sends even the smallest signal that something may be wrong with your circulation, the most important thing you can do is pause and listen. Blood clots often give you a chance to act early, but only if you respond the right way. 1. What to do immediately. First aid steps. If you notice sudden swelling, heaviness, discoloration, or unusual pain in one leg, stop any intense movement right away. Avoid massaging or rubbing the area. This can actually loosen a clot and push it toward the lungs. Instead, gently elevate your leg about 4 to 8 inches and take a moment to observe what's happening. Does the skin color change? Does the temperature feel different? Is the swelling increasing? Your body will often show you what it needs if you slow down long enough to notice. 2. When to seek emergency care. Some symptoms simply can't wait. If anything worsens within a few hours, more swelling, spreading discoloration, sudden tenderness, it's time to get help. And if shortness of breath, chest tightness, dizziness, or a racing heartbeat appear, call 911 immediately. These can be signs that a clot has moved to the lungs, and every minute matters. 3. When you can monitor at home, but still see a doctor soon. Mild swelling, light heaviness, or brief discoloration that comes and goes may not require an ambulance, but they do require attention. If these symptoms repeat, even occasionally, schedule a medical check. Clots often build slowly before they become dangerous. 4. Hidden risk factors. Older adults often miss. People over 50 are more vulnerable to clots, especially if they sit for long periods, more than 2 hours at a time, or don't drink enough water. Health conditions like heart disease, diabetes, and obesity also increase the risk. Even certain medications can thicken the blood or make clots more likely. If you notice any of these signs, don't ignore them. Your body is trying to protect you, and listening early can save your life. Your body is never silent. It's speaking to you every single day, through your energy, your breath, your heartbeat, and yes, even through your legs. The problem is, most of us were never taught how to understand that language. So when your leg swells, or turns cold, or changes color, it's not just age. It's your body whispering a warning long before danger arrives. And here's the comforting truth. Blood clots rarely appear out of nowhere. They almost always send signals first, sometimes for weeks, sometimes for months. Your job isn't to become a doctor. Your job is simply to notice when something feels different, unusual, or one-sided. When you listen early, you give yourself the best chance to stay safe. So let this be your reminder. You are not powerless. You are not too old to understand your body. And the choices you make today, even something as simple as paying attention to your legs, can protect your future in ways you may never fully realize. Before you go, I'd love to hear from you. Have you ever experienced any of the 7 signs we talked about today? Your story might help someone else recognize their own. And please, share this video with anyone over 50. A small piece of information shared at the right moment can truly save a life. You never know whose life you might be protecting just by sending them this message. Your health matters. Your awareness matters. And your body is always trying to guide you. All you need to do is listen.